Yo everyone, we got breaking news that's honestly pretty wild. Trump just responded to the Hantavirus outbreak and his answer was not great.
This just happened yesterday.
So a reporter asked Trump if Americans should be worried about hantavirus spreading, and Trump's response was literally, quote, I hope not, we'll do the best we can.
I hope not.
That's his public health strategy? Hope?
But here's the kicker. His administration cut funding to study hantavirus in 2025, the exact virus that's now spreading.
Wait, so he defunded research on the virus and now he's hoping it doesn't spread?
And there's more. RFK Jr. eliminated all the cruise ship health inspectors last year.
All right, so today we're breaking down Trump's hantavirus response, what he cut, what's actually happening with the outbreak, and giving you the AI verdict. Is this prepared leadership or just wishful thinking?
Let's analyze the data.
Okay, first off, what's actually happening with this hantavirus outbreak?
Cruise ship called MV Hondius departed Argentina heading to Spain. 3 people dead, 8 confirmed cases. And it's spreading. Passengers have returned to 5 U.S. states, Arizona, California, Georgia, Virginia, Texas, all being monitored for symptoms.
What makes this virus dangerous?
Hantavirus kills 35% of people who get respiratory symptoms, up to 15% who get hemorrhagic fever. There's no treatment, no cure.
No cure?
None. Early medical attention can help, but mainly you just hope your immune system wins.
And it spreads person to person.
Complicated, usually from rodents to humans, but this specific strain, Andes virus, can spread human to human. That's what makes it scary.
So we have a deadly virus with no cure that can spread between people, and passengers are now in 5 states?
That's the situation Trump was asked about yesterday.
So what exactly did Trump say when reporters asked about this?
Reporter asked, have you been briefed on hantavirus? Trump, yes, I have.
And then?
Reporter, what have you learned? Trump, it's very much, we hope, under control.
We hope under control.
Then the reporter asked, should Americans be concerned it's going to spread?
And?
Trump, I hope not. We'll do the best we can.
That's not very reassuring.
It's not exactly inspiring confidence in the response.
It's giving me COVID flashbacks when he said the virus would disappear like a miracle.
Same energy, hope instead of a plan.
But here's where it gets really problematic. What did his administration actually cut?
In 2025, Trump eliminated funding for the Centers for Research in Emerging Infectious Diseases, all 10 research centers.
And these studied what exactly?
One of them, the West African Center for Emerging Infectious Diseases, had a pilot project specifically studying hantavirus transmission.
So, they were literally studying how hantavirus jumps from animals to humans and how it spreads between people.
The exact knowledge we need right now. Trump's NIH called the research, quote, unsafe and shut it down.
What else did they eliminate?
RFK Jr.'s health department eliminated all cruise ship inspectors from the CDC's vessel sanitation program. All of them? Every single cruise ship health inspector. Gone.
So, no one was monitoring cruise ships for disease outbreaks, and we stopped researching the exact virus that's now spreading.
That's the situation.
Let's talk about this specific outbreak. What went wrong on the ship?
Passengers paid up to $29,000 for this luxury cruise, some sharing cabins with strangers.
29 grand and you're sharing a cabin.
First person died on board, but here's the problem. Passengers had already left the ship at St. Helena Island on April 24th. So people were spreading out before anyone knew there was an outbreak. 26 passengers from 12 different countries disembarked, went home, started showing symptoms later. And they were in contact with how many people? Nobody knows. That's why 5 states are now monitoring. Could be hundreds of contacts. Didn't you say a doctor on the ship got infected? Yes, medical professional had to be evacuated to Europe for treatment. If doctors are getting sick,
That suggests this is pretty contagious. How are other countries handling this compared to the US?
Spain is isolating and monitoring their nationals in government facilities. Germany tracked down airplane passengers who flew with an infected person.
What do you mean, tracked down airplane passengers?
KLM Airline contacted everyone on a flight where an infected Dutch woman had been. Full contact tracing.
And the US response is?
We're monitoring people. Trump says, "I hope not," when asked about spread.
Who's actually in charge of the U.S. response?
RFK Jr. is health secretary, the guy who eliminated the cruise ship inspectors.
So the person who removed our cruise ship safety net is now managing the cruise ship outbreak?
That's correct.
Great leadership synergy there.
What do scientists actually know about this virus? Research Hantavirus has been studied since the Korean War. We know a lot about most strains. But this specific Andes strain that spreads human to human, we know much less. That's exactly what the research Trump cut was studying.
How does human-to-human transmission work?
That's the problem. We don't know for sure. Maybe through saliva, maybe aerosol droplets like coughing. The research was supposed to figure that out. Incubation. How long before symptoms show up? Can be days or weeks. Long incubation period means infected people are walking around spreading it without knowing.
Detection. Can we test for it quickly?
Tests take time. By the time you confirm someone has it, they've potentially infected many others. And once someone has it, supportive care. Keep them alive and hope their immune system wins. That's it.
This has to be politically damaging for Trump, right?
It should be. Cut research, eliminated inspectors. Now outbreak happens, and his response is, "I hope not."
It's like COVID all over again. Unprepared, hoping for the best.
Except this time, he actively removed the safeguards beforehand.
What are Democrats saying?
They're calling it predictable negligence, saying you can't hope your way through a public health crisis.
And what about RFK Jr.? Is he defending eliminating the inspectors?
He's been mostly silent. Hard to defend removing cruise ship inspectors during a cruise ship outbreak.
How do voters typically react to health crises?
If handled well, it can boost a president. If handled poorly, it destroys approval ratings.
And I hope not count as handling it well?
Probably not.
So what actually happens next with this outbreak?
Right now, we're in the waiting phase, watching people in 5 states to see if they develop symptoms.
How long do we wait?
Incubation period can be weeks, so we might not know the full scope for a month.
If it starts spreading in the U.S., then what?
That depends on how prepared our public health system is, which apparently isn't very since Trump cut the research and inspectors.
Treatment? Any chance of developing treatment quickly?
Without the research infrastructure Trump eliminated, it's much harder, starting from scratch.
What can people actually do to protect themselves?
Avoid contact with sick people, practice good hygiene, but if you are on that cruise or around someone who was, get medical attention immediately if you feel sick.
And preventing the next outbreak?
Would require rebuilding the research and inspection systems Trump dismantled.
All right, time for the AI verdict. Let's analyze Trump's hantavirus response objectively.
AI assessment of Trump's pandemic preparedness and response. Preparation phase 2025. X. Eliminated hantavirus research funding. X. Removed all cruise ship health inspectors. X. Dismantled early warning systems. X. Ignored scientific advice on unsafe research. Response phase, May 2026. X. I hope not when asked about spread. X. No detailed public health plan announced. X. Minimal contact tracing compared to other countries. X. Reactive rather than proactive measures. Positive factors. X. Claims to be briefed on the situation. X. Promises full report, though delayed. X. CDC monitoring people in affected states. X. International cooperation continuing.
So what's the AI verdict?
AI verdict. Inadequate preparation, wishful thinking response. Trump created vulnerabilities by cutting safeguards, then relied on hope rather than science when crisis emerged. Probability this approach contains outbreak, 40%. Probability outbreak spreads in US, 35%. Probability political damage to Trump, 75%. Probability Congress restores funding, 60%.
So basically, he made us less prepared, then crossed his fingers.
AI analysis suggests this represents a pattern of defunding prevention, then hoping problems don't materialize. When problems do materialize, response defaults to optimism rather than evidence-based action.
How does this compare to other countries' responses?
Countries with intact public health infrastructure are responding more systematically. Contact tracing, isolation facilities, coordinated monitoring. U.S. response appears improvised due to deliberately weakened capabilities.
All right, so here's where we are. Deadly hantavirus outbreak spreading from a cruise ship to 5 U.S. states.
Trump cut research on this exact virus back in 2025, eliminated cruise ship inspectors. Now says, I hope not, when asked about spread.
It's a pattern of cutting preparedness, then hoping crises don't happen.
When crises do happen, hope isn't a public health strategy.
II calculates 40% chance current approach contains outbreak, 35% chance it spreads further.
75% chance this damages Trump politically if outbreak worsens.
What do you think? Is I hope not adequate pandemic leadership? Should Trump have kept the research funding and cruise inspectors? Drop your verdict in the comments.
And subscribe because this story is developing daily. We'll track whether the outbreak spreads, whether funding gets restored, and whether hope works as a public health policy.
This affects everyone who travels, everyone who could be exposed. It's not just politics, it's public safety.
And right now, our public safety depends on hoping a deadly virus doesn't spread.
That's not a strategy, that's wishful thinking.
We'll keep giving you the AI analysis as this unfolds.
Stay safe out there and stay informed.